There's a lady here in the red top.
Thank you for the opportunity. My name is Yvette Knights, and my question is in relation to maternity services. And I'd really like to know why midwives are going to be subject to medical veto. Women getting permission from a doctor to see a private midwife. It should be a woman's right to choose a doctor, or not a doctor or the government. Why are women not given this right to decide what happens to their bodies?
Good. Thanks for the question. I've got the Health Minister here, Nicola Roxon, to answer your question.
Thank you. Look, I'm pleased.
You need to push the button, Nicola.
Thank you. Thank you. Thank you. I'm pleased.
No, still not on.
Okay.
Mine's on.
Okay. Thank you. I'm pleased to have the chance to discuss this, because obviously it's an issue that's been causing a lot of concern in the community, and certainly one that Catherine has raised on behalf of a number of constituents. We need to clarify, though, some misunderstanding. The government is actually, for the first time ever, expanding the choice of women to be able, let me finish, to be able to choose to use a midwife and to have the Medicare benefits schedule pay for it. $120 million in this year's budget, never been provided before, currently being blocked in the Senate, I might add, by the Liberal Party, but nevertheless a big change we are trying to achieve. The issue that others have raised, and I think you're referring to, is whether that new extension of recognising midwives and giving Australian women more choice applies to women who choose to have a baby at home. And we've made a decision that because we're making this change for the first time and expanding what midwives are able to do and be publicly funded for, that we are going to be cautious in the way we expand it, and have not made the decision to extend taxpayers' money to fund home birthing midwives. What we have done, because there was a very real problem with this proposal, was there was a risk that our changes, well-intentioned, were going to have the consequence of driving home birthing underground and making it illegal. And we absolutely have now guaranteed, working with the states and territories, that that will not occur, because we do believe women should have that choice. But we do think that when you're expanding services for a government, to actually tread cautiously. And the truth is, though it's a very important choice that we don't want to take away from women, it's less than 0.5% of Australian births across the country currently at home. So what we're doing in the period of time, expanding services for midwives, expanding choices for women, and working with those who want to provide services to women at home to make sure we've got some backup protocols in place, so if something does go wrong, that there are agreements with the hospital or doctor to be able to step in quickly. And that is a conservative approach, but it isn't a conservative approach to say midwives are doing good work, have never been recognised in the history of providing Medicare for the last 50 years, and we're going to actually change that. So maybe not as far as you want to go, but we're very proud of what we're doing in expanding choice, and know that people will lobby for it to go further in the future.
Over here, folks. Thank you. There's a young fellow there with the curly hair. That's you in the black here. Sorry, there's a lady behind you in the black. But since you've been picked, I'll come back to you next time. Is that okay? So, yeah, the lady with the little one on her lap. That's it.
Thank you, Mr. Rudd. My name is Faye Kricak.
And she's going to grab that microphone and take it.
I'm a mother and a secondary teacher, and I'm also the president of the Ballarat Maternity Coalition branch. And I've got one question for you. Under the new Medicare for Midwives reforms, can you promise me that my choices in birth will not be restricted by the AMA, my local GP, or the whim of the management of my local hospital? And please, when you answer that question, can you not just talk about home birth, because that's just one small part of these reforms that's affecting all women's access to midwifery?
Sure. Except I'm going to have Nicola answer the question. She's the authoritative minister on this, and she's been dealing with these matters in detail. Nicola.
Thank you. Yes. Thank you. Yes, I can guarantee that your rights won't be vetoed by the AMA. If this government was going to let the AMA veto what we did, we would never have made these commitments in the budget. Let's be quite honest about it. The doctors and obstetricians did not want this change. what they have been prepared to do, as many midwives have been prepared to, is work with us now that the government has shown that we are determined to expand choices. But I think the point that you're making is, are we going to require people to work together and have backup arrangements if things do get more complicated? And the answer to that is yes. We don't believe that by expanding choice we should actually fragment the care that women have, when what we were being asked for is to actually improve the continuity of care. So I'm unapologetically on the record as saying let's encourage people across the health services spectrum to work together and make sure that women can safely choose options that are good for them and suit them. And as I say, I can absolutely tell you this change would never have come about if we were prepared to just let doctors veto what we're doing. At the same time, we want to be careful about change and make sure that there are backups and protections in place if, as we know sometimes can happen, birthing gets complicated.
Okay. The lady up there with the long hair, is that okay? That's you. Yeah. No. Just there on the edge. That's it. Yeah.
Thank you very much. My name's Michelle McRitchie and I'm from Ballarat Maternity Coalition.
Hey, why?
The third question.
I'm striking it hot here.
This is a big issue and it's going to be a big election issue as well. I actually went down to the consultations today for the framework that is actually going to be revolving around home birth midwives. And at that consultation, we were told very directly that the guidelines and the rules will exclude breech birth, vaginal birth after caesarean, other risk factors that obstetricians place on us, but private midwives don't. For example, vaginal birth after caesarean has a 100% success rate in Victoria. 30 women have done that in the last few years and no issues, no deaths or anything like that at home. And about 70 to 80% of women who choose home birth have risk factors like myself. Obviously it's an emotional issue and you can hear that. So we were told very clearly today it will exclude us. So can you tell me what your thoughts are on that? Any other part of medical care, there is a right to refusal and there's a right to also have the medical care that we require. So I've been told today that I will either be forced into hospital or I will have to free birth.
Okay, Nicola, you've got the trifecta.
Thank you. I think it is a big ask for the Prime Minister to have to pretend that he can make an assessment about individual women's risk factors, breech, post-Caesar or otherwise. There is quite an established body of work about how we assess what is safe birthing, and I understand that it's contestable because many women who would like more support at home think that those rules have all been made by medical practitioners. But put yourself in the position of the government. We have to make sure if we are expanding either public funding or insurance, the two hot button issues, that we do it in a way when we are absolutely guaranteed it's going to be safer. So here in Victoria, and the Health Minister in Victoria is actually running those consultations. They've just announced that they're actually establishing 3 home birthing trials linked or auspiced by 3 public hospitals, for the very reason that we need to establish some better evidence about what is a risk factor that should give you this choice and what isn't. It's very complex. I'm confident that it's moving in the right direction. I'm sure everybody won't be happy, but I think for us to move in a sensible and cautious way is a good thing to do, and it will probably take a few meetings and maybe some frustrations for it to be able to move, but I'm confident that we will get a constructive change.
Over this way here. Is that a gentleman up there in the green shirt up the back who's been very patient? That's you. Yeah.
Thanks. Andrew Lang from Lismore. I'm a farmer. I'm not a member of the Maternity Coalition, but I sympathise with them.